Okay, hello everyone. Welcome to today's webinar entitled Creating a Career Within Capstone Project. My name is Song Kim Lapingal. I'm a senior lecturer and program coordinator in the Data Analytics and Policy program, and also have Dr. Colin Pascal, the program director of our program. And I'm really happy to have Keith Winter and Shriya Jamakandi, recent alums from our program. Shriya Jamakandi is a data scientist at Public Consulting Group, and Keith Winter is a venture partner with Teal Ventures. Sorry. Since we're in the data analytics program, I asked R to choose the order of our today's presentation. So Keith will go first, and then Shriya will share her experience in the Capstone project. So Keith, take it over.
Okay, thank you for the intro. Let me just share my screen. Okay, so a little background on me. I graduated in December, and I also have an MBA from UT Austin, and I work as a healthcare technology investor. And I actively use the things I learned in my degree in evaluating data science startups. So, for instance, we just invested in a company that does natural language processing. So I'm pretty active in being able to use my degree. And then in terms of interest, you'll see why this matters in the future, but it's data science, healthcare, and travel. So I kind of stepped back and I was thinking about what would I have liked to know about doing my capstone before I did it. And I think in addition to it being a requirement of graduation, there are a variety of reasons why it can be beneficial to you. You can use it as a foundation for future research. There's a potential to publish your paper. It's a writing sample for future graduate admissions. I've used it for applying to other programs, and it's been really helpful. It's also potentially a work sample for job interviewing, and nothing precludes you when you're having a job interview from sending it in to the hiring manager. And then you can also add it to your resume. So there's a lot of reasons why you want to put a lot of effort into your capstone other than just for graduation. So I'm going to give you some advice, and then I'm going to talk about my capstone in particular, and then Shriya is going to do something similar. She's going to show her actual capstone. I'm just going to show you a few pieces of mine. So, and these are things I would have liked to known before I started my capstone. My suggestion is to work on a project you're really passionate about, because you're going to put a lot of time and effort into this, and it's a fairly substantial endeavor. Start early. I think if you do anything, do that. And one of the things you may not be aware of, but you can use an initial project that you started elsewhere and expand upon it with the instructor's consent. So that may help you access data, and it may help you in terms of what you want to do. And then keep in mind there are a lot of topics that really merit investigation, but you really need to be able to access data for it. And then a few of the people in my capstone cohort had problems because they had a great topic, but in the end of the day, they couldn't find data for it. So you have to really consider that, because you are going to be using data as part of the project. Be careful too. This is advice Dr. Perez, my capstone instructor, gave me, is don't be too broad. You can easily get caught up in a really broad project, and it'll be a monumental task to try and get it completed. And then if you procrastinate, boy, this is not a course for you. You really need to keep on track, and you can't wait till the last minute and try and get everything done. It just doesn't work. And so I went to UT, and I had to do a thesis at UT. And it was a lot different than the capstone project. For a thesis, generally you just have a professor you work with. But I think the capstone class is great because in addition to your professor, you have lectures and readings. They're not too onerous, but they help guide you in development of your capstone. And then you also have fellow students for feedback, which was great for me. A lot of them were just truly great writers. And, there were discussion boards where we were talking about things. And it's just really helpful to have other people take a look at your project. I was lucky enough for some reason to take the quantitative methods class kind of towards the end of my program at Johns Hopkins, but I found that course to be really, really helpful in working through a variety of things on the capstone. So if you've taken it already, you may want to just brush up on it because I thought it was really helpful. You can, in terms of getting data, there's data that's out there you can find, but, you can contact the organizations themselves. And I was able to contact the WHO, and I talked to one of their analysts, and she gave me some advice, which was really helpful. So nothing precludes you from not doing that. She also pointed me in the direction of a few things that were really helpful. And then the last piece of advice is enjoy the project. I found it to be a lot of fun and really rewarding. So I'm going to give you a little bit of an overview of my capstone. And in general, the capstones, they're capped at 30 pages. And the first 5 pages or so are the cover, abstract, you have a table of contents, and then some of the other lists for the graphs and things like that. And then the actual body will be roughly about 20 pages. There'll be an intro. You'll do a literature review, data and methods, results, conclusions, and next steps. And then you also have references. In my particular paper, that was 4 pages. And lastly, you have a CV. So maximum on this is 30 pages. From what I've seen, just looking at other people, it's generally 25 pages or so. So on my project, I was actually taking the GIS class, and I really like things global. So for the GIS class, I did some global maps, and it had to do with urban development and the corresponding BMI rate. So there's theories about how development has caused obesity. And so that was one of the things I was looking at. And there was a lot of data. So this is a really good example of, you really have to find something that has data to make it useful. So this 75 to 2015, 41 years I had on the initial project, but all it was urbanization and overweight. So for my project, I'm using panel data. And for those of you, just to refresh you, if you look at the red lines, those are cross-sectional. So you're just comparing years. You could be doing time series, which may be more like the purple lines. But if you do panel data, you'll have several years, and then you'll also have several rows. In my case, is that was really countries. But the one nice thing about panel data, there are a lot of things you can do statistically that'll help you and better clarify the end result. So just to give you an idea, I started in the GIS class with 41 years. And then when I went after all the data I needed, it just wasn't available for that time period. So for my capstone, I took a 20-year period. And you can see it had some ramifications in that it reduced the number of countries. But in terms of population, I still had a large part of the world population. So now, once I got into my capstone, I had to find all kinds of control variables, right? And here's the list of all the variables I looked at. I didn't use all these because some of them had multicollinearity. So I took them out, but this will give you an idea of the amount of data collection you really need to do to basically do a great study that can eliminate omitted variable bias. And then I know this is a bit of an eye chart, but this is effectively the results and the first part, I did 4 categories. So this is just a normal linear regression. And then these are all the last 3, 2, 3, and 4 are panel models. And you can see when you look at the R squared, when you use a panel model, it can help you clarify things that are going on in the data that you may not have been able to collect. So you can see the R square when I used the panel model was more like 0.46 as opposed to a pure correlative model would have been 78.78. So some other things that were, I was very lucky with k-means clustering. I didn't have a lot of luck in my coursework with clustering, but when I got to this project, it was really interesting because k-means clustering identified some clusters that merited further exploration. And then if you map them, what you found is they're really mid-Africa and Southeast Asia. And so there are really interesting clusters going on in the data. One other thing I had to do, which I don't know how much we really talked about in the AAP program, but I saw several other papers do it, is when you have clusters, sometimes they're very different. And so you can do this thing called match clustering, where you take the bigger cluster and try to make it match in certain types of variables. So here I was matching an income and median age. And you can still see that once you do that, sugar was still an issue. And then I also matched on urbanization rate. And effectively what was happening is that some of those areas, the cluster in Central Africa and Southeast Asia, they are urbanizing at an earlier age and a lower income. So that caused a major difference between the two. Then one of the last things I found in the literature review, the results were all over the place. And so that was one of the reasons I really liked this topic. And the reason they were all over the place is that there were a lot of country studies, and it really depended upon where you were in urbanization as to disparity between urban and rural areas. And you can see as you become more urbanized, they actually come together. And in the United States, they're actually, the rural areas are having a higher BMI now. But this was one of the things I was able to find when I went through and pulled all the data across the panel, which was a little bit harder to see if you're just doing a country study. So that was my my last slide. Shriya, do you want to go now? And then I guess we can do questions.
Sure, that sounds great.
Yeah, I forgot to mention earlier. So like we'll have Keith just had his presentation, then Shriya will have hers, and then after that, we will have Q&A session. And if you have any questions, people in the audience, please put that in either in the Q&A or in the chat. Yeah, and then we'll come back to that after Shriya.
Sure. So I'm going to share my screen now and talk a little bit about my capstone. So a little bit of introduction. I graduated from Tufts in 2018 with a major in public health and a minor in economics. I currently work at Public Consulting Group, and I've been there since 2018. And I graduated from DAP in August of 2022. And I'm currently a data scientist within PCG's Medicaid policy and waiver demonstration group, which basically means we work on Medicaid policy across the country, and we help states develop their Medicaid programs. And in the fall, I'll be attending Brown University's PhD program in health services research, and I'm interested in studying Medicaid and the role of ACOs, or accountable care organizations, in access to care. Similarly, my capstone topic was also related to this, and I looked at exploring the role of funding on practice site satisfaction with Medicaid ACOs. So I'm just going to give a brief summary of what my capstone was about, and then I'll dive into some advice and thoughts to consider, and then I'll just show you like the actual capstone, like the Word document. So as I mentioned, my capstone looked at Medicaid ACOs and primary care practice sites to see how they work together to deliver care to Medicaid patients. And specifically, I was interested in seeing how practice sites felt about the accountable care organizations and the Medicaid programs that they were working with. So accountable care organizations are a group of medical care providers or medical practice sites that come together to deliver and coordinate healthcare services. And so the way that I was able to do this was I acquired this practice site survey from my employer, Public Consulting Group, and we fielded this survey in 2018. And the survey was given to 353 practice sites. Each of these practice sites served Medicaid patients. And I was able to use data from this practice site to see whether or not receiving funding at the practice site level was associated with greater satisfaction with greater satisfaction with both the Medicaid program and being part of the Medicaid ACO. And I did this by using a logit regression. And I basically found that the relationship between receiving funding and satisfaction were positively associated when you studied the bivariate relationship, but that relationship is no longer significant when you control for other facets of the medical practice site experience. And I can talk a little bit more about that when I share the paper. So what I did find, importantly, were that the findings were in line with prior public service delivery research. So in the literature review, I found that there was this theory called direct service experience theory, which basically said that when participants were directly engaged with the service that they were receiving and they had a say in that service, they were more likely to be satisfied. And that lined up pretty closely to what I found because direct practice engagement with the ACO and participation in Medicaid ACO decision-making were positively associated with satisfaction. And then in addition to funding, I also provided a recommendation where I said that facilitating direct practice site interactions with Medicaid programs and accountable care programs can prove beneficial for policymakers. And that's something that I added at the end of my capstone because I really just wanted to wrap it up and say, okay, well, what was the reason that I did this research? What is the purpose of it? And what does it mean to policymakers? So that's a little bit about my capstone. So in general, when you're thinking about your capstone, I'm going to echo a lot of what Keith said because he had fantastic advice and I would 100% echo everything that he said. So the capstone is really an opportunity to explore a quantitative research problem and learn more about a policy topic that you find interesting. And I think one thing that can be super helpful is reviewing past coursework, particularly from your favorite classes in the program. So which class did you like the best? And also you can look at past syllabi and see what topics or lessons you found particularly interesting. And even just looking at like readings from past coursework could be really helpful. And also, as Keith mentioned, starting early, it really is key. And so reaching out to faculty with whom you've taken courses can be beneficial in starting early because you've already established a relationship with the faculty member, you've already taken classes with them, and you might also have an idea of what you want to look at. And they can also help you flesh out your topic, which is huge. And so I think you don't necessarily have to be 100% certain about what you want to do, but it can be helpful to kind of talk to someone ahead of time and figure out, I would say at least like a semester in advance, figure out, what you would like to look at potentially. And so another thing to consider is what area of the policy do you find most interesting? And I think it's really crucial that you continue to find this topic interesting as you work through the class, because, when you encounter challenges in the paper, that will be really motivating, knowing that you really care about this topic and it's something that you want to continue to pursue. And so, as I mentioned, you can read academic literature, you can talk to people. I think it's also a great way to get started on your literature review as you head into the program, or I'm sorry, as you head into the class. And so I think a couple of key questions to ask, I like to summarize them as why, when, what, who, and how. These are questions that I asked myself as I was developing my topic. And the most important I'd say is, why are you interested in this topic? Just make sure it's something that you are interested in and that you are passionate about. And another important question to ask is, how are you going to answer your question? And, who would you need to reach out to get access to data? Because data is huge. If you can't access the data, then you don't want to run into a situation where, you're like halfway through the course and then you realize, oh my God, wait, I can't get access to this data. So I would say reaching out to people ahead of time can also help with that. And then what? So the what is also really important. So what are some potential research questions? And particularly, are they broad enough so that you can explore them and you can, there's enough literature out there to build up a foundation for your literature review? And also, are they narrow enough to potentially be assessed in one semester using quantitative methods? So that's really important to consider the scope of the class as well. And also when are you taking this capstone? That's important to think about because it might help to start planning, as I mentioned, a semester early, but you can definitely, you'll have time the first few weeks of class as well, and you can figure out your potential topic at that time too. And so one thing I wanted to point out was the University of Michigan's ICPSR source. I think this is the Inter-University Consortium for Political and Social Science Research. I might have misquoted what the letters stand for, but it's a very good source to use, and I highly recommend it because you have a lot of publicly available data, and using publicly available data can be beneficial because you won't have data restrictions. So, for example, I used private data, and so I can't actually share my capstone. Like I can't publish it as a paper because I used private data. So I think one thing to think about is what type of data are you using and where are you getting the data from? And so I would really recommend the data sets, especially the thematic collections. They're really helpful. Like if you know, for example, that you want to look at like, I don't know, child and family data policy, or like, you know, if you want to look at like education policy or something like that, you can definitely find thematic collections at this source. So I highly recommend it. And last but not least, I think a lot of this is just going to echo what Keith has said as well. And so, you know, you have to think about the capstone as a publishable paper, which you can discuss in job interviews, and that's huge. And you can also use it when you apply to grad school. If you want to, you know, if you want to get like other degrees, you can definitely use that as something that you submit for your writing sample. And being flexible with your research topic is really huge, because your topic might change over the course of the semester as you figure out whether or not you can use data, but you know, whether or not like the research question makes sense, or whether, you know, based on what you find in your literature review, you can change your methods. So your paper will evolve, and I think your peers are a huge part of providing that feedback and kind of helping you shape that paper, as well as your instructor. So taking full advantage of that can be supremely beneficial. And data cleaning also takes a little bit of time, so it's really important to plan in advance for that. And then another way to explore the topic, like I mentioned, is looking at data sources that are available. So if you're, for example, interested in health insurance coverage, you can think about the data sources that are out there for health insurance coverage. So one thing that I would recommend is looking at the American Community Survey, which is publicly available and put out by the Census Bureau. And, you know, you can look at other questions that are also in the survey to figure out trends in coverage related to demographic variables like education, income, anything else like that. So I would say that starting with a data source can also be a really helpful way to think about it. And with that being said, I'm going to share the actual capstone document that I used. Let me show you what that looks like. Okay, so for some reason, I'm actually having trouble sharing the Word document. It's not popping up, but let me try again. Okay, there it is. Okay, so the capstone document itself, as Keith mentioned, should be around 30 pages. Mine was a little bit more, but that was okay. But roughly around like 30 pages is really where you want to keep it. And so you start off with a title page, you know, where you're going to put your title. Everyone basically also has to put the statement that says a capstone submitted to Hopkins, and then you also say, you know, all rights reserved and everything like that. There's like an actual format that you have to follow, and you'll get that format. And then you'll start with your abstract, and you'll, you know, have a little summary of your paper. And then you'll go into like acknowledgements. There's like an acknowledgement section for that. And then you'll have your table of contents, which will likely come together at the very end. So I wouldn't worry about that in the beginning. And I also wouldn't worry about the abstract in the beginning either. That's something that I would write at the very end, actually, once you've found your results and once you can actually speak to what you found. And then, you know, as Keith mentioned, you know, you have the basic structure. You have the introduction where you provide some background and context. It can help to break it up into subsections as well, which I found was really useful for me, putting in subsections within the major sections. And then you'll have to use footnotes to cite your work. And then, you know, you'll also have other sections. So this is the intro section, and then you'll have your literature review. And then you'll have your data and analysis section where you talk about your data sources. And so I used survey data, so I had to talk about sampling as well. And that's actually really important to think about, like the data source and the types of methodologies that you might have to consider. And I would say that if you're using survey data, it can also be hugely beneficial to take the survey methodology class either alongside your capstone or even before your capstone, as well as the quant methods class, which is super, super helpful. So I think those two classes were really helpful for me. And one thing that I found was beneficial was including a variable descriptions table because I use survey data. So I had to talk about the scales for each question. And that really helped readers kind of understand what the point value was for each kind of variable that I was looking at. So if we're looking at satisfaction, it was originally from 1 to 5, but I binarized it. So I ended up using a logit regression to look at that. And I ended up actually binarizing everything. But having this table kind of especially helped people who were not familiar with my survey understand what I was looking at and how I translated that into a regression model. So I highly recommend having a variable descriptions table. The other thing that I would also recommend is having a basic summary statistics table, which can also help orient people to your work and can also help orient people to what your data set looks like. Because I think getting people familiar with what the data looks like at a very baseline level, like, what's the mean, min, max, I think that's really important too. And yeah, then I used R to basically make all of my visualizations. And so I had a couple of graphs. And as you noticed, you kind of just embed the figures into the flow of your paper. And I'm just going to scroll through pretty quickly because this is the analysis section. And yeah, I think, I talked a lot about bivariate, multivariate regression analysis because I found differences in the analysis. I had different results when I used a bivariate versus a multivariate regression. And so I did focus on that, but I think you can really structure your you can really structure your analysis section based on the analysis method that you are using. And I think that's probably going to take up the chunk of your analysis portion. And I think what's really helpful is if you are using regressions to make a predicted probabilities table, because that can help people understand what your outcomes actually mean and translating your outcomes to meaningful findings for people who are not familiar with your data. So I think having tables throughout your paper that can do things like this, whether it's a summary table, whether it's a variable descriptions table, whether it's a predicted probabilities table, can be really, really beneficial. And then, of course, you have the discussion and conclusions where you talk about your findings and you kind of just reiterate what you've said before. And then I had a references section as well. And that was my capstone paper.
Great. Thank you, Keith and Shriya, for sharing your thoughts and your actual capstone projects. So yeah, we'll move on to the Q&A session. If you have any questions, feel free to ask them in the chat or Q&A board. Before people collect their thoughts on these on your projects, I actually have some questions, so maybe I can start with that. So I know that both of you come from kind of professional background, so I was wondering, because I don't have any of that experience outside of academia, so I was wondering how, if you had any initial research idea before you come into the program and how that evolved throughout the program as you take classes or work on the capstone project.
I really didn't, because when I came into the program, but I was really interested in travel and all things global. So I think that's why I took the GIS class. And then from the GIS class, I've always wondered about things that are research, but people have a lot of different opinions, right? And so with the causes of obesity, I think there are a lot of different opinions. So that was one of the reasons why I really wanted to do that research. And I didn't really say it, but in the end, what my paper was showing is that sugar was always the prevalent thing. Things like calories and fat and protein really didn't matter. It was always sugar, no matter how you cut the data. So.
Yeah, and so I can also say that I didn't have a concrete idea of what I wanted to look at for my capstone when I came into the program as well. But I did know that I was really interested in Medicaid, and I did know that I would potentially want to use survey data from my employer. So I spoke to my employer about halfway through the program, and I asked if I could use the data that I used, and they signed off on that. So that I did know. But in terms of narrowing the research question, I actually worked with Dr. Bachner to kind of narrow that question down. Originally, I had said, what is the relationship between health equity and satisfaction, which was huge. And, we had to cut that down and kind of figure out how to actually quantify things. And she was really helpful. So I actually ended up making a slide deck of potential research topics and sending it to her a couple of weeks before the Capstone course. And she provided feedback. She just had put in comments on the slide deck and said, oh, this one sounds good. You can flesh this topic out, or this one's really broad. And so I think getting that feedback was super helpful for me.
Yeah, I had a similar experience with Dr. Perez because there are a lot of other things I could have done. There was gender information. As a matter of fact, people in my class were asking me about that. But when she and I talked about it, it was just going to be a massive undertaking. So I wasn't able to do it. But it was one of those things I'd like to do for future research, to kind of go back and look at it, because there are definitely differences. And I saw a few studies with that. But, you really have to narrow it down so you can get through it, unfortunately.
So we have one question on the Q&A, and I think we kind of covered this. What was the process of refining your research question so that it was broad enough for data, but not too broad enough for the time you had to write the paper? Anything you want to add to this question?
I think that was the one we just answered, but I think there's another one in the chat.
Mm-hmm.
Thanks for sharing. I was wondering. Oh, yeah, that's a really good question. So the question is about doing something original, and then you start researching and you see that there are other papers. And yeah, I think that's a really good point, but that's part of the literature review to find that. And then, one thing you could do is when you go down that route, you could alter your research a little bit. So it would be new research. Shriya, did you have anything else to add to that?
Yeah, so I actually had like the opposite issue with my paper, where no one had done any research on funding and practice site satisfaction. There was literally nothing out there. So we ended up having to apply research from stakeholder satisfaction theory and from public management theory to make, to kind of fit the model that I was looking at, and kind of trying to understand how satisfaction works, because Medicaid is a public service program. And so, yeah, so I would say, maybe think about the literature review early on. And I think that can help with the question of, how can I have like an original research topic? Because doing the literature review, I would even say like doing like a very simple, like almost like skimming articles before you actually draft your research question and put together a research question can be really beneficial, because you will find out pretty quickly whether or not there's significant amounts of research on your topic. And I think if it's something that, there's benefits to both sides. There's benefits to it having been explored extensively, and then there's benefits to it not being explored at all. And so I think you kind of have to walk that fine line in finding something that has enough literature out there that you can put together a paper, but, also hasn't already been done.
So I think Jessica's asking a question about the k-means clustering. So what was interesting is I didn't have a lot of luck with clustering in some of the other classes I took. And then ArcGIS, which is the software you use for mapping, they've built in a variety of data science into it. And then so I found that cluster using that. And my clusters were very well defined. It was incredible how clean the clusters were. And you saw in the picture, it has to do largely with the state of development and diet in those different regions. And I was just trying to look at the data in any way I could to see, just search for findings. So, but it was a really nice finding. And the thing I'd have to say too is it really helped me better understand the data, because if you didn't see the cluster, it would have been meshed into a bigger population, and I don't think you'd understand it as well.
I have a related question, like for both of you, like in terms of choosing like model specification and which like method to use for your regression analysis, basically. Was it just like, did you decide the like models on your own? Like, was there any like particular course or like faculty, like interaction with faculty that help you decide on like, this is the best method for my research question?
I can answer that. So I was taking the quantitative methods, and there was a paper about using panel data and how a researcher was using panel data and going back and looking at cross-sectional studies and correcting them because they had too high of a correlation. So I got really interested in panel data. But what I found was, we hadn't done a huge amount of work in panel data. So I decided to jump in. And then there were a few other people in the Capstone using panel data, and we found a paper from Princeton that gave a lot of data on how to pick which panel model to use. So it's, to me, the key learning is, everything we learned at school in the program is foundational, right? And don't be afraid to go out and expand upon it because you have a great foundation. It's just the reality. And I found that was like a constant thing with the professors, is that I think they always wanted you to go figure things out, right? It's not just giving you all the answers. You need to go figure it out. And so that's part of what I had to do in using the panel model.
Yeah, I agree with a lot of that. I think to echo what Keith said, I think if you can bring an idea to a professor and say, hey, this is the research question that I'm thinking about exploring. This is how people have assessed it or analyzed it in the past. And I'm potentially thinking about maybe using these models to assess it. I think that can help your professor kind of shape the feedback that they give you. The more information you give them, the more they can help you. And I think that's what I found to be beneficial. So for my capstone, when you're looking at practice site data, I found that a lot of people had used regression modeling, particularly either logit regressions or linear regressions. And logit regressions, I use logit regressions because I ended up binarizing my outcome. I really wanted to simplify like whether people were satisfied or not satisfied. And I wanted to make it a clear-cut outcome. So that kind of determined what model I ended up using. But
I have a very practical question. And it is, first of all, so it sounds like at least one of you, I guess it was Keith, was taking quantitative methods at the same time that they were taking the Capstone course. Shriya, were you taking it just by itself, or did you take it with another course at the same time?
So I took the quant methods class a semester before.
Okay.
Yeah.
And so my follow-up to that is, can you give us a sense of kind of in terms of just work schedule, the amount of time, hours per week that you were devoting to the Capstone project? How did you budget your time, and what was sort of the ebbs and flows of that? What did that look like over the course of the semester?
Yeah, I may be more of a planner, so I started it pretty early, and because early on, Dr. Bachner said to me, "Oh, this could be something interesting for your capstone. You should be thinking about that," which planted the seed, which was great. And then, so I kind of started early. What was interesting is I was taking quantitative methods while doing the capstone, and I was waiting for the panel data session to be released so I could work on it. So it kind of slowed me down a little bit. But and then for mine, it became a labor of love, and I put a lot of effort into it. But for the reasons I outlined at the beginning of my presentation, I think it's really worthy of it. It is, if you don't have a great writing sample, and I don't think I had a great one beforehand, it's a fabulous writing sample as just an example. And I think if you're going to be working in this space, which I assume you're going to be, it's a great work sample. So, I would try and get into it and start figuring things out as soon as possible, because if you're going to do a great job on it, I think it's just going to take a lot of time.
Yeah, I really echo that, because once I knew, for example, that I wanted to use survey data for my capstone, I started designing my course load to kind of align with preparation for the capstone. So I basically ended up designing my coursework so that I took survey methodology, so that I took quant methods, and I had taken like, healthcare analytics, anything that could have possibly helped me on my capstone before I took the capstone course. But that being said, I really do think that quant methods is like the single most important class that you can take for the capstone. And I think either taking that with the capstone or taking that just before the capstone can be really, really beneficial.
I'm glad you feel that way, because I completely felt that way. You just learn a lot of things, the pitfalls and the things you need to adjust for in a paper.
Yeah, it's like highly applicable.
So I think there's another question from Ashley about language packages. So for mine, I used ArcGIS, but I also used Python and R. But for the panel data, I believe it's in R, there's a PLM package for it. And I ended up using that. And R was more than adequate to handle, it had all the tests. After you get a panel going, there are a bunch of tests to figure out which is the right one to use. And I could access all those in R. So it worked out well.
Yeah, I also used R simply for the same reason. There's so many packages. There's literally a package for almost everything that you could want to do in my experience. So I debated between using R and Stata actually, but because of the data cleaning, I ended up using R because I just found that tidyr was way better. So.
So I have another question. So it's like with the capstone project, I guess like I was wondering how it actually helped your like career path after graduation. And I know that like maybe for Shriya it helped with the PhD program, but like I don't know, maybe there was some other things that helped, like developing your like professional career. So could you share that?
Yeah, so for me, definitely it was something that I talked about during my PhD application process. And it was also something that I was asked about in interviews quite a lot, actually, because it's an area of research that I'm really interested in, and it is something that I want to explore in my PhD program. So I was able to draw from a lot of what I had learned in my capstone course. So that definitely helped. And in terms of my career, it's directly linked to the work that we do at PCG. It was using survey data from PCG. So my company was very interested in the findings, and my mentors were definitely, I actually sent them my capstone and they were really interested in the research. So.
Yeah, for me, I've actually applied to other master's programs, and I can tell you that everyone I applied to or I submitted it as a writing sample, I was accepted. So you don't need R to know that's 100%, which is great. The other thing is it is a cohesive project to pull things together that you learned, which I think was really helpful to me. Just in thinking about how everything fits together when you go through it and all the pitfalls of, finding data, cleaning data, needing more data, all those things and all the iterations you need to go through. So I think it just gives you a really cohesive idea that if you're at work or, at another program and you need to do a big project like this, what you'd need to do and going through it all.
Yeah, to kind of echo that, I'd say like the strategy and the planning required to put together this paper, like that gives you skills that are applicable anywhere, really. I think putting together a paper that answers a research question, coming up with a way to answer it, I think those are really great skills to transfer anywhere.
Okay, any other questions from the audience? Oh, one more question from Ashley.
Oh, that's a great question. So yes, I didn't have a lot of literature that was on point. So I focused more on process, actually. Yeah, that's a really great point. And I looked at stakeholder satisfaction theory, and I ended up applying processes from public management theory and stakeholder theory to my healthcare question, which actually ended up being very applicable because I was looking at a public service. So I was so Medicaid essentially, and I was able to apply direct service experience theory for that. But yeah, I had to do a little bit of digging to kind of find anything that was applicable. So.
Okay. Great. So thank you everyone for coming. Thank you, Keith and Shriya, for sharing your experiences. And yeah, it's great to have you both. And I guess have a good night, everyone.
Good luck, everyone.
Yes, good
Bye.
luck. Thank you.
Thanks so much.